What in tarnation is a C-SNP? C-SNP stands for Chronic Condition Special Needs Plan. It's a type of Medicare Advantage plan made just for folks with certain chronic conditions. You know, things like diabetes, heart failure, COPD, even dementia. Imagine if Medicare were a pair of shoes. Original Medicare is like those stiff old dress shoes. They get the job done, but ain't exactly comfortable. A C-SNP? That's like orthopedic sneakers with memory foam soles, made just for your walk of life. Who qualifies for C-SNP? To get into a C-SNP, your client needs original Medicare, Parts A and B, and a diagnosed chronic condition from a list approved by CMS. That list includes diabetes, cardiovascular disorders, chronic heart failure, COPD, ESRD, kidney problems, dementia, HIV/AIDS, mental health conditions, stroke, substance use disorder, and a few more. Basically, if your client's chart looks like a CVS receipt, they might just qualify. Why should agents even care? Now you might ask, Grandma E, why should I talk about these plans when I've already got HMO and PPO sales lined up? Because 20% of Medicare Advantage members are already in SNPs, and C-SNP enrollment jumped 45% from last year. And guess what? Half the folks on Medicare have one of these qualifying conditions, so it ain't a niche, it's a gold mine. The three types of C-SNPs. CMS allows 3 flavors of C-SNPs, depending on the carrier. Single condition C-SNP. Everyone in the plan has the same condition, like diabetes. Multiple condition, all required. Members must have all conditions in a list, e.g., diabetes and heart disease. Multiple condition, anyone qualifies. Members need just one condition from a list, like a buffet. Take your pick. You got to check the carrier details to see which kind they offer. That's your job, partner, not mine. When can they enroll? Well, ain't this the million-dollar question? Enrollment happens during the usual periods, or if they get a qualifying diagnosis, that's their Special Enrollment Period, SEP, Initial Enrollment Period, IEP, around their 65th birthday. AEP, October 15th to December, good old annual enrollment. SEP, get diagnosed with a chronic condition and bam, they can enroll into a C-SNP. SEP stays valid until it's used, like a coupon, but for healthcare. When and how to talk about it. You can talk about C-SNPs if the client brings it up, it's AEP or their initial enrollment period, you've got a SOA, and you're discussing Medicare Advantage. Let's make it plain. Here's how they differ. C-SNPs are for folks with chronic illnesses. D-SNPs are for folks who qualify for both Medicare and Medicaid. Both types include Part D drug coverage, but only D-SNPs are required to coordinate with Medicaid. C-SNPs usually include care management to help clients navigate their chronic condition. D-SNPs might not always include that kind of hands-on support. So remember, C is for condition, D is for duals, so don't confuse them. Just remember, C is for condition, D is for duals. Easy peasy. Young agent, these C-SNPs ain't just extra letters. They're lifelines for folks who need focused care. You're not just selling plans, you're changing lives. Help your client go from overwhelmed to overjoyed with the right plan for their health needs. Whew! That's enough educating for one day. Now, if you'll excuse me, it's time for my afternoon nap and reruns of Matlock.